everyone. I'm Dr. Chethana Dharmapalaiah. I'm a consultant rheumatologist working at Aster CMI Hospital in Nepal. So let's look at some frequently asked questions by people about what is rheumatology and what are various aspects of rheumatology and the diseases that we treat today. Many patients confuse orthopedics and rheumatology. So how do they differ? And when should they see a rheumatologist and when should they see an orthopedic surgeon? So that's a very commonly asked question. So orthopedic surgeons, they deal with problems which are related to structures that form the musculoskeletal system. That is, they look at diseases that affect bones, joints, muscles, tendons, which are all there around joints. They also see wear and tear type of arthritis. So somebody who has had an injury previously maybe or developed wear and tear in the joints due to old age, they develop something called osteoarthritis. So when they need a surgical treatment option, then orthopedic surgeons are the one that treat them. Orthopedic surgeons mostly deal with patients who come with injuries or repeated strains or sprains, and also dislocations and fractures. Whereas a rheumatologist is a doctor in internal medicine who specializes later on in a subject called rheumatology. So rheumatology is a subject which deals with autoimmune diseases, wherein the immune system could attack normal parts of our own body, that is, it will attack the healthy tissues. There are many rheumatological conditions we treat like rheumatoid arthritis, lupus, systemic sclerosis, etc. So if somebody is suspected to have an autoimmune disease, then they should come and see a rheumatologist. What are the early signs of arthritis that patients shouldn't ignore, and what are the most common causes of chronic joint pain besides arthritis? So that's a very commonly asked question. So the symptoms of arthritis, the early symptoms of arthritis include persistent and prolonged joint pains. So if somebody has persistent pain for more than 4 to 6 weeks affecting various joints, but commonly the small joints of the fingers, the wrists, knees, ankles and the feet, associated with swelling, severe morning stiffness, so the stiffness lasting more than 30 to 60 minutes in the morning, and warmth and swelling and redness in the affected joints. Some patients may also have fatigue, some weight loss, feverishness. These are all symptoms of early arthritis, and if somebody has these, then they should consult a doctor early so that the treatment is given early. Then the other part is, what are the other causes of chronic joint pain besides arthritis? These include maybe trauma to the joint or other structures around the joint like tendon bursa causing bursitis, tendinitis. These are the other causes. So for someone with diagnosed arthritis, what are the non-surgical treatment options that are available? So it depends whether this is osteoarthritis or inflammatory arthritis. If it is osteoarthritis, the non-surgical options include medications. These are mainly analgesics or painkiller medications or non-steroidal drugs. Sometimes we also give supplements like glucosamine and chondroitin sulfate. When it comes to rheumatoid sort of arthritis, then the medications include something called disease-modifying anti-rheumatic drugs. So with these, we can prevent worsening of the arthritis and halt the disease progression. Apart from medications, other treatment options include heat and cold therapy, physiotherapy, occupational therapy, which includes using of walking aids, braces for the knees, etc. And physiotherapy including low impact exercises, and when the arthritis is a bit better, then weight bearing kind of exercises. Sometimes we also offer local injections into the joints, application of anti-inflammatory gels to the joints. These are all some non-surgical treatment options that are available. What are some common autoimmune diseases that rheumatologists treat, and how do they affect daily life? So the most common autoimmune diseases that we treat are rheumatoid arthritis. Apart from that, we also see patients who have psoriatic arthritis, that is associated with skin psoriasis. We see patients with spondylitis called ankylosing spondylitis. We see patients with fibromyalgia, which is chronic pain conditions. We also see patients who have osteoporosis, and also some types of crystal arthritis like gout, pseudo-gout. So when it comes to arthritis, so patients who have severe arthritis could have severe swelling, deformity of the joints, which could affect their day-to-day activities. So they could have difficulty with simple tasks of their daily living, like washing, cooking, even walking, for example. So all the daily activities could get affected if they have a very severe form of arthritis. Apart from pain, they could also have fatigue, tiredness, low mood, which could all impact their day-to-day activities. Can regular exercise help people with joint pains, or does it make the pain worse? So when somebody has a very acute, severe, painful, swollen joint, then it is better to rest the joint until the pain subsides a little and take some medications to help the pain. But once the acute pain subsides, for all patients with arthritis, exercise is given in the form of a prescription on their prescription. So every patient with arthritis has to exercise. So there are several ways exercises are beneficial for patients with arthritis. It helps to reduce the stiffness, pain in the joints. It improves the mobility or the flexibility of the joints. And exercise helps to strengthen the muscles around the joint, which are required to hold the joint and give it support. Exercise is also beneficial to improve mood, improve energy, and it also improves the sleep quality of patients. So exercise is an integral part of treatment of various types of arthritis. How can patients tell the difference between normal fatigue and fatigue caused by rheumatic conditions? So normal fatigue or normal tiredness is what most people experience maybe after a long day's work or a very strenuous physical activity, for example. So normal tiredness or fatigue will usually recover with rest. So after a good night's sleep, the following day you should feel better. Whereas fatigue that's associated with autoimmune conditions is very prolonged, it is very overwhelming, persistent, and it usually does not go away with sleeping overnight. So even the next morning they would feel that their sleep has been unrefreshing and the fatigue will continue. Along with fatigue, they would also experience other symptoms of arthritis like pain, swelling or stiffness in the joints, and they usually have a poor quality of sleep, tiredness, low mood, etc. So that is how we usually differentiate more severe form of fatigue that happens in autoimmune diseases. How much do diet and lifestyle affect conditions like arthritis or autoimmune diseases? This is a very commonly asked question, so no consultation is complete without a discussion of the diet. Diet and lifestyle play a very important role in management of autoimmune diseases and various types of arthritis. Following an anti-inflammatory kind of a diet would be beneficial. This includes Mediterranean type of diet, which includes bright colored vegetables like various colored bell peppers, broccoli maybe, beetroot. So these have antioxidants which are supposed to have an antioxidant and anti-inflammatory effect. So apart from following plant-based diet, patients could also avoid consuming a lot of red meat because it has a pro-inflammatory effect and it could worsen some aspects of arthritis and autoimmune diseases. Coming to lifestyle, various things that patients could adapt and change in their lifestyle could be beneficial for management of arthritis. And this includes things like avoiding smoking, limiting the consumption of alcohol, exercising on a regular basis. So any form of regular physical activity like walking, cycling, non-weight bearing exercise like swimming, or even weight bearing exercises or strength training, Pilates, yoga, Tai Chi. These are all very, very beneficial for arthritis patients, and improving their lifestyle in the form of maintaining a good body weight, eating a healthy, balanced diet are all beneficial. What's one piece of advice you would give to patients to keep their bones and joints healthy for the long run? So first of all, a healthy, balanced diet which is rich in calcium and vitamin D. So good sources of calcium include green leafy vegetables,